Listen to this, man. He got some good news for you. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. The doctor is in the house.
Hey, ladies and gentlemen, the doctor is in the
Dr. Ron,
house.
unfiltered, uncensored, is for people who are tired of being misled, over-medicated, and dismissed by the sick care system. Dr. Ron, unfiltered, uncensored, stands as the fearless voice of clarity and empowerment. Unlike sanitized health media or corporate-aligned medical messaging, Dr. Ron delivers bold, evidence-informed insights that cut through confusion and restore personal agency. His mission is simple and radical. Give people the truth, give them tools, and give them back control of their health.
Hey, welcome everybody. We'll try and record this today and see how it goes. And I want to talk to you today about medical testing and how it's a paradox when testing can make you sicker. Because more testing doesn't always mean better health. Sometimes it means more disease. So we're going to dig into this today. As I wrote in my Substack writings, that this can be a problem and can make more people patients. So let's dig into this. So what if I told you that the very test your doctor ordered to be safe was the moment you became a patient? Not because you were sick, but because something was found. Ladies and gentlemen, in today's world, we've been conditioned to believe more testing equals better care. Oh, my doctor does 1 million tests, so he brings up all these beautiful charts, and they are all color-coded. But I want to tell you, more data equals more certainty. Really? But what if that assumption is wrong? What if more testing doesn't always lead to better outcomes? What if it leads to more dangerous and more diagnosis and more treatment, which is dangerous and sometimes harmful? So let's unpack this without going down too many rabbit trails. And I call this the medical test paradox, because in modern medicine, you don't need to feel sick to become a patient. Remember, for me, it is an illusion that more is better. Let's start with the simple truth. Every medical test is designed to find abnormalities. That's its job. But here's the problem. The human body is full of variation. Not every abnormality is disease. Not every finding needs to be treated. Yet, the more tests we run, the more abnormalities we uncover. So the question becomes, are we detecting disease or are we detecting normal human variation and calling it a disease? Because once something is found, it rarely gets ignored. So when testing makes you sicker. All right, let's get a few. More testing does not mean better care, because the more you look, the more you're going to find. And we're going to get into this normal. What is normal? What is the problem with normal? Let's talk about something I'm sure you've never questioned. Although if you've listened to my show, you know I have always questioned what is normal, and we should replace that with what is optimal. So the idea of normal, you get your lab results back and you're told you're normal. But what does that actually mean? In most cases, normal is based on a statistical range, not an optimal range. Normal is not optimal. Labs typically take a large population and define normal as the middle 95%. Look something like this. Take normal, the middle 95, and you have 2.5% sickness on either side. That means even if you are perfectly healthy, you can fall outside that range. But here's the deeper issue. The population used to define normal is not a healthy population. It includes people with chronic inflammation, insulin resistance, early metabolic dysfunction. So now you're being compared not to the ideal physiology, but to an already compromised population, which means normal may simply mean common. It's common to be that number, not optimal. You take this a step further, and when you test large numbers of people who feel fine, they just went to the doctor and said, well, I'm going to order some tests. You increase the likelihood of false positives. A false positive means the test says something is wrong and there isn't anything. And here's the principle that we don't talk about and you don't know about. The lower your risk of disease, the healthier you are, the higher the chance that a positive test, is wrong. Now, that's not an opinion, that's the math. So when we apply testing broadly, especially in low-risk populations, we start labeling healthy people as abnormal. And once that label is applied, everything changes. So you're 5% of healthy people, just from this 2.5% on either side, are likely to be labeled unhealthy. And remember, the population that is being sampled to get these values are sick people. And some of them, as we've talked about, what happened, a disease doesn't happen overnight. So you have things going on in your system, especially with using the seed oils that are making you sick, but not yet getting a disease. You're in that population that they study. And these false positives, these incidental findings, are they normal? Can they be a problem? Well, let me give you an example. Prostate cancer screening started with that PSA test. When PSA testing became widespread, everybody was finding prostate cancers. And at first, that sounded good. We're making progress on prostate cancer. But over time, something really important was realized. Many of these cancers were slow growing. They would never have caused harm. Yet, once they were detected, what happened? Biopsy, surgery, radiation, hormone therapy. And what happens with those treatments? Well, men became incontinent. They had sexual dysfunction. They had a reduced quality of life, all for a disease that may never have impacted on their lifespan. So is that prevention? Is that what you really want? Or is that overdiagnosis? And the domino effect comes into play, or the cascade effect, as people call it. Once one abnormal test really stays isolated. What do I mean by that? Because it will result in you getting another test, a referral to a specialist, a procedure, a diagnosis, and a medication. That is the cascade or domino effect. And each step carries risk, not just a physical risk, but a psychological risk as well, because once you're labeled, you start to see yourself differently. You start living as a patient, even if you felt perfectly well before the test. So the healthier you are, the more likely you are bound to have something wrong with the way the system is set up. But testing is not the enemy. It is not the enemy. Let me be clear about that. But unquestioning testing, if you don't question the testing, that is the enemy. So we've created a system that prioritizes detection over understanding. Are we confused? Sure. Information with insight, detection with prevention. So we've confused information from getting all these tests with insight. We've confused detection, just finding something, with prevention. Not so. So we become very good at finding problems, but not always good at creating help, because not every abnormality needs to be treated, and not every test leads to a better outcome. So what do you do? Well, let's bring it down to some action steps. Stop reflexive testing. Don't get tests just because it's routine or it's time to get a test. Testing without a purpose is not prevention. It is not prevention. It is exposure. That's what we call reflexive testing. Demand clinical justification. Before any test, ask, why am I doing this? What will we do if it's positive? Will it actually change anything? If you don't get a clear answer, that's time for a pause. And don't confuse normal with healthy. A normal lab value does not guarantee health. An abnormal value does not always mean disease. The context matters. How you feel matters. How you function matters. Should you avoid testing altogether? Absolutely not. It has value, but it has to be used thoughtfully and strategically. The biggest mistake we all make is assuming that every abnormal result is dangerous. I'm telling you, it is not. So what matters? Well, your physiology matters, how you're feeling, how you're doing on a daily basis. How's your energy? How's your strength? How's your quality of sleep? How's your quality of thought? Do you have brain fog, etc.? They're the real markers of health. So we built a system that searches relentlessly for disease, even in people who feel perfectly fine. Go for a physical. Well, we're going to get some blood tests and we're going to get some x-rays just to be sure. They're going to find something. And sometimes in that search, they create the very problem they were trying to prevent. They find something. So don't fear testing, but don't blindly trust it either. Use it wisely. Use it with purpose, because health is not found in the lab reports. You build your health day by day, eating clean food, organic food, staying away from seed oils, staying away from those processed, adulterated oils. You build your health day by day through how you live. Okay? Not here to tell you not to test. I'm telling you to ask questions, get justification, and respect that once you have an abnormal test, it's going to result in more testing. Do not try not to, because once somebody says it's abnormal, you're going to have a psychological impact. Try not to make the rest of your decisions out of fear. Do not avoid testing, but build on your health. Okay. Why am I telling you this? Because I want you to have the knowledge that not all testing is necessary. I'm not here to filter the truth. I'm here to amplify the truth. Modern medicine equates more testing with better care. But there's a paradox beneath the surface. Increased screening has led to rising rates of overdiagnosis, false positives, and unnecessary treatment. And the statistically flawed normal ranges have unintended consequences of early detection. And then you have this cascade of interventions, which of themselves can have side effects. And not every test finds a disease. Sometimes it creates it. So that's the paradox in testing, ladies and gentlemen. Is there more to say? Well, not really. I mean, let me be clear, though. Testing is not an enemy. Just make sure you question it. Just make sure you have questions for your doctor. Why am I getting this test? What happens if it's positive? Have a plan. And just because something is found does not mean it needs to be treated. Second and third opinions, not a problem. Okay, so Stop reflexive testing, demand clinical justification, understand the difference between normal and optimal. I hate when people say, oh, it's normal for your age. Well, you're 80 years old, your testosterone level's 200. It's normal for your age. No, gentlemen, we want our testosterone levels the same as when we were 25 and 30. We want them optimal when we were feeling great and had lots of energy and drive. We don't want to be normal for our age. It's just like aging is not a disease. No one dies of old age. They die of something else. Pay attention to your body, your energy, your brain fog, your strength, your quality, how clear you're thinking. Shift your mindset from what can we find to what can I improve? I'm feeling pretty good, but I'm not sleeping so good or something like that. What can we improve? Okay. And strategically use testing, not emotionally. So they're your orders. Simple, not always easy, but follow them and you stay control of your health, not the system. Okay, ladies and gentlemen, that's it for today. I don't filter the truth. I amplify it. And hopefully we will be back next week. And I'm going to just keep hammering on the medical system. We have to make medicine great again. We don't want to become pill-popping senior citizens. And we want to try and prevent disease. And how do we do that? Well, by lifestyle changes, avoiding the seed oils, replacing them with unadulterated oils. Get rid of all the chemicals that you can in your diet. All of the estrogen from the soybeans and so forth. Estrogen is killing us. That's how we become healthy. Okay, Freddie is going to take us home, and we'll see you again next week. Have a great week.
Hey everybody, Dr. Ron's finished for the day. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. And let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. The doctor is in the house. And let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house.